My name is Melissa, and I'm going to be talking about carpal tunnel syndrome today. So carpal tunnel syndrome is a compression or an irritation of the median nerve as it runs through your carpal tunnel in the wrist. To the right, you've got a picture. So your carpal bones make up one side of that tunnel, and the retinaculum is the other side. And in there, it's a really small space, and inside it, you've got a lot of tendons, plus an artery and a nerve. So it's pretty easy for things to get compressed. This is mostly an overuse injury caused by repetitive motion. So someone who's working on like a factory line, on an assembly line, doing the same motion over and over. This is the most common nerve entrapment that occurs in the body, and it's one of the most common upper extremity disorders, but it's mostly common in older adults. So people 40 to 65, middle-aged, who have been doing the repetitive motion with their hands for a really long time. Women are 3 times more likely to develop carpal tunnel syndrome than men, and it can often be associated with things like rheumatoid arthritis, diabetes, pregnancy, obesity, some kind of trauma that displaces your carpal bones and decreases the space in your carpal tunnel. And there have been a lot of studies that really connect family history and whether it's genetics or something like that with carpal tunnel. It can be classified as mild, moderate, or severe. There's not really a formal classification system. Your signs and symptoms of carpal tunnel are going to occur along your median nerve distribution in the hand, but in severe cases, it can actually radiate into the forearm, the arm, or the shoulder. You're basically going to have all your neurological signs, so pain, tingling, numbness, burning. You may have loss of sensation. The patient may tell you that they feel like their fingers are swollen, but there's not actually going to be any swelling present. A decreased grip strength, and they may tell you that they drop things a lot, especially if they have to hold something for a long time. So like holding onto a phone for a period of time may be hard for them. There's going to be a lot of nighttime pain, and it may be severe enough to wake them up at night. So a lot of them will have something called a flick sign, where they'll flick their wrist to try and diminish that pain or the tingling. And in severe advanced cases, there can be thenar weakness and atrophy, so the thumb will actually lose some of its strength. When you're evaluating this, you're mostly going to make your diagnosis based on your history and your physical findings. And if they have severe symptoms that are radiating, like farther up into the arm and the shoulder, it is important to do a full evaluation of the neck and the shoulder to make sure that it's not occurring higher up on the nerve or that it's not caused by something else. Your test that you can do for this, a 2-point discrimination test to see how good their fingers can tell what's going on. Phelan's maneuver, which is just a prolonged wrist flexion to see if that compression of the nerve will recreate any symptoms. Tennell's sign, a median nerve compression test, hand elevation test, and sometimes they will recommend nerve conduction studies or an electromyography, but research has shown that this is better for ruling things out, that it's not necessarily going to tell you, yes, this person has carpal tunnel syndrome. Treatment, mostly you're going to go for conservative treatment first for anywhere from 6 weeks to 3 months. If you get to 3 months of conservative treatment and it's not making your pain go away, it's not making things better, then you're going to opt for surgery most likely. Conservative treatment consists of splinting, especially at night. Corticosteroids, either oral or injected. If you opt for an injection, there is always a chance that you could get that needle into the nerve or damage other structures in there. But most likely if you have a doctor who has been doing this, knows what he's doing, you're going to be fine. They recommend lifestyle modifications, so trying to reduce that repetitive motion, and nerve guiding exercises to kind of loosen up the nerve in that carpal tunnel. One article did list some alternative therapies, yoga, carpal bone mobilizations, making switches like to an ergonomic keyboard, ultrasound and acupuncture, but there is not really any research to back any of that up, so it's not proven to be helpful. And when you're taking any kind of pain medication, NSAIDs, like ibuprofen, are not going to be effective. You have to have the corticosteroids. So in surgery, you can have 3 types of surgery. An open surgery where they slice open your wrist, pull apart your retinaculum, and stitch you back up. It takes about 15 minutes total, real quick, minimal complications. Nowadays they're doing some endoscopic surgeries, which have kind of a lower success rate. They might have to go back in and do it again. Or a couple articles mentioned a minimal incision, which is kind of halfway between an open or an endoscopic. Surgery does have good long-term outcomes. It's going to really reduce all your symptoms and pretty much get rid of your carpal tunnel syndrome. But there are some minor complications that come along with any surgeries. You're going to have pain, decreased range of motion. You're going to have those scars that are going to be tender, but that's all going to go away pretty quickly, so you're not going to have a lot of long-term effects from this. And So are there any questions?
Can you demonstrate the flick sign?
So it's just something that people are going to do. They're going to have pain, they're going to flick their wrist because it'll try and make it go away. Like, they'll walk around, like, just kind of shake their hand
Cool.
and attempt to get rid of that pain or that feeling.
Okay.